7th European Aniridia Conference in Stockholm, Sweden. 3 days of work to talk about the future of treatments and surgical treatments for aniridia. In this moment we are together with Dominique Bremond Gignac, who is professor at ophthalmology at the University of Necker enfants in Paris. So thank you for being with us.
Thank you very much, Matteo.
So Dominique, we want to talk with you about the posterior segment of the eye in eye with aniridia, because usually we talk a lot about the anterior segment, so the missing of the iris and something like that, but is very, very important also to better understand the posterior segment. So according to your research, we remember in Alicante that you talked about the bad development of the fovea, and this is very important to understand in order to better consider also a lot of symptoms connected with the eye with aniridia. So in today you presented other kind of research always connected to the posterior segment. What are the results you found and why they are important?
Thank you very much, Matteo, because it's really very relevant to underline that there is posterior segment anomalies in congenital aniridia, because it's usually missed, and this is very important. So we already demonstrated that macular and foveal hypoplasia is quite it's very important and more present sometimes than iris anomalies in congenital aniridia, of course PAX6 related. In the two studies I just presented, there is a first study on the vascularization of the fovea, and we did OCT, which is optical coherence tomography of the macula and fovea, and also angio-OCT, which is angiographic OCT. And we calculated the density of the vessels in the center, in the fovea, and in the parafoveal area. And we had also control patient to calculate the same thing. And we found that there is more vessels in the fovea compared to the control group, and there is also less vessels in the parafoveal area, which is absolutely abnormal development of the macula, because it should be less vessels in the center, and in this case this is the contrary. So it demonstrates the maldevelopment of the macula and PAX6 related congenital aniridia. The second point is a second study, and the second study was on optic disc. We know that there could be optic disc anomalies, hypoplasia, in congenital aniridia. And so we calculated in children and adults with ultra-wide field fundus, and we calculated the optic disc compared to the distance with the fovea, and we found, comparing also with control group, that there is smaller optic disc, and this smaller optic disc is also related with the grading of the macula or fovea hypoplasia. So if in conclusion, the maldevelopment of the macula and also the smaller optic disc contribute to a low vision in patients with congenital aniridia PAX6 related.
And what could be the challenges and opportunities coming from your research in order to treat this kind of bad development of the fovea and the macular and these sort of smaller optical disc in respect of the, we can say, normal people?
Well, nobody is normal for sure.
No, absolutely. In fact, I put it in the bracket, but about, we can say, about without aniridia, okay.
Well, it's very difficult today to have a solution, but if we just remember, we had ataluren, and for the mice study, there were an improvement of the macula. So I don't know how it could be. We are working on eye drops of ataluren, but it takes a long time to demonstrate safety. And,
so we need again a lot of time to study from the mice to come to the yes,
to human.
exactly.
We must be very careful, of course, but we are working on this, and we are working on all those features to try to improve. And I have no solution at the time, but I wish I could find one.
And we really hope this. And according to, just to give maybe some advices to medical doctors, but also to our audience, in order to manage, monitor, check the state of the art of the fovea, macula, what are the most important steps to do in this sense?
I think this is very important to recognize the foveal hypoplasia, and in children, as soon as possible, to make, if possible, general anesthesia and examination, and if possible with OCT, which is not so easy because it's quite expensive device. But even if it's not possible in younger children, to have an OCT and in children it could be, but in older children. So this is important to get OCT and also wide field fundus to know everything about this.
To make an inspection in the eye and
to understand low vision in the child, for instance.
Thank you for your advice and for being with us.
A pleasure, and I hope long life for Aniridia Europe and everything. And thank you very much, Matteo, because you are always present for this.
Thank you.
Okay.